This is Dr. Xia from Shanghai Jiaotong University School of Medicine, Ruijin Hospital. She comes from ultrasound department because in China, ultrasound is divided from big radiology departments. We only do ultrasound, but we are very focused on this. Today's topic of Dr. Xia is the future of microvascular assessments with super-resolution ultrasound in small parts. Welcome.
Yeah. Ladies and gentlemen, good morning. My name is Xia from Ruijin Hospital, Shanghai Jiaotong University School of Medicine. Today, I'm very happy to be here to present some of our work on microvascular assessment with super-resolution ultrasound in small parts. Super-resolution ultrasound is a new technique which produces images with higher resolution than traditional ultrasound, and compared to the Doppler ultrasound and contrast-enhanced ultrasound, SRUS allows us for the imaging of microvessels at 10 micron scale. And in our study, we applied SRUS in small parts like breast, lymph node, and nerve with the equipment VINNO Ultimus 9, and the ultra-resolution microscopy in VINNO was the technique we used for SRUS imaging. Firstly, I would like to talk about SRUS in breast. As SRUS relies on contrast agent, so before we acquire the URM, we need to inject the microbubble into the patient's distal vein. And when the first of the microbubble goes into the breast mass, we acquire the URM. And then the density map, velocity map, and direction map would be analyzed. And you see here, the SRUS videos would also be acquired. Looking at this video, you can see the pattern of the vessels. The blood flow goes from the center of the breast mass to the peripheral area of this mass, and the vessels are thin, clear, and ordered. So that may be a pattern that indicates you to diagnose this breast mass. And based on density map and velocity map, we will do some quantitative parameters like the density analysis, which includes vessel ratio, the density, complexity level, vessel diameter, distance between vessels, and also the velocity analysis as well as perfusion index. So what we are looking at this case, it indicates absolutely it's benign breast mass, right? So, and it was finally confirmed as fibroadenoma in pathology. This is another case which is round breast mass with clear margin on B mode, and after the acquisition of URM, we get the density map, velocity map, and direction map, as well as the video of SRUS. It showed absolutely more abundant of blood flow in this case, and especially in the peripheral area of this case. The vessels are, you looking at this video, and the maps, the vessels are more coarse, and it's a radiating pattern. So that indicates actually malignant breast mass possibly. And based on the density map and the velocity map, we did the density analysis and velocity analysis, as well as the perfusion index. So this case was actually finally confirmed as invasive ductal carcinoma in pathology. When we're comparing the quantitative parameters between malignant and benign breast mass, we have found that higher vessel ratio, complexity level, higher vessel velocity, and larger curvature were found in breast cancer. And we have performed another study to use the SRUS to show the interstitial lymphatic network of the breast tumor. The sonar view was injected into the center of the breast tumor, and then the URM would be acquired, and the three maps would be analyzed. So when comparing the quantitative parameters between the breast cancer and the benign breast tumor, we found that the density of lymphatic vessels of breast cancer is lower than that of benign tumors. Then we go to the next part, which I will show you the SRUS imaging in sentinel lymph node of breast cancer. It is known that the evaluation of sentinel lymph node is very important for therapeutic strategy in breast cancer. And in anatomy, actually, there are two systems: the blood capillary system and the lymphatic capillary system in sentinel lymph node. And it is very important to imaging both of the two systems in sentinel lymph node of breast cancer. And before we imaging the two systems, one thing is very important. That is the sentinel lymph node mapping. 1 millimeter of contrast agent was injected intradermally to the periareolar area of this patient, and then the sentinel lymph node was defined as the first enhanced lymph node. At the end of each lymphatic channel, you may see, looking at this video, this is the sentinel lymph node, and you can see clearly about the lymphatic channel. And this case is a reactive lymph node, and after we located this sentinel lymph node, we then start the acquisition of URM, and then a density map, velocity map, and direction map would be analyzed. And looking at the SRUS video, it showed clearly about the afferent lymph vessel, which is here, and the efferent lymph vessel, which is here. And this is imaging of a lymphatic capillary pattern of a reactive sentinel lymph node. After the microbubble was disrupted in the lymphatic capillary, we started to capture the imaging of blood capillary by SRUS. And this is through the vein. The microbubble will be injected to the patient's distal vein, and the volume is 2.4 millimeter. And then we get the 3 maps. And this is a pattern of imaging the blood capillary of a reactive sentinel lymph node. And we move to another case, which is a metastatic sentinel lymph node. You can see clearly that the microbubble goes into the lymph node through the afferent lymph vessel, and those microbubbles stays in the margin of the cortex, right? And there's an interesting sign called perfusion defect on this lymph node, so which may indicate a metastatic one. And then when we imaging the blood capillary, this one showed a very beautiful and visualization on the microvascular structure of this metastatic lymph node, which is here. And when we're comparing the quantitative parameters of reactive lymph node and metastatic lymph node, it was found that higher vessel ratio, complexity level, vessel density, and larger curvature of the blood capillary were found in metastatic sentinel lymph node. And when comparing, after imaging the lymphatic capillary, we compare the quantitative parameters between the reactive and the metastatic lymph node. It was found that the thick cortex, perfusion defect, higher density, and the lower velocity of lymphatic capillary were found in metastatic one. And next part, I will introduce the SRUS imaging in diabetes patients. We show the nerve muscle microcirculation by SRUS. This is a healthy one, the visualization of median nerve of the healthy volunteer, which is here. It clearly showed that the epineural vessels and the intervascular vessels in the median nerve. And when visualization the median nerve in the diabetes patients, it showed here, you see the blood flow actually increased. And we have also visualized the blood flow of the thenar muscles. And in the diabetic patients in the diabetic feet, the blood flow actually increased compared to the healthy volunteer. And this is a visualization of distal tibial nerve in the diabetic feet. You can see a very thick vessel at the capsule of the tibial nerve. And when we're comparing the diabetic feet with a healthy volunteer, it showed that the blood flow of the tibial nerve and the soleus increased a lot, and both the density and the velocity increased in the diabetic feet. So what is the future of SRUS? Based on our previous studies, SRUS provides us with a large amount of parameters. You see, one measurement can produce huge data. So it takes a lot of burden for us to analyze this data. So we are trying to explore a potential approach to quantify the abundant information provided by SRUS imaging. This is a concept, ultrasomics, which was actually established in 2019. It uses computer-based method to extract a large number of ultra features from ultrasound images in a high throughput manner for analysis. So based on this concept, we put off another concept, which is called ultrasound microvascular mix. And this shows the process of this concept. It was based on SRUS images, and ROI segmentation would be performed on this image. And then feature extraction would be performed using machine learning technology, and after that, these data would be used for modeling. This concept actually was published in European Radiology in 2024 by the Chinese Artificial Intelligence Alliance for Thyroid and Breast Ultrasound. This is a consensus statement in China, and which was led by Dr. Jianqiao Zhou. He's here. And then in our team, we would like to take another concept, which is called SRUS-based habitat imaging. And this is the process of habitat imaging, and there's a little bit different of SRUS-based habitat imaging, which is we take SRUS images for analysis, and there's a different step which is called clustering and habitat generation before feature extraction. This is also based on machine learning method. As we all know, habitat imaging is used for evaluate tumor heterogeneity, and SRUS-based habitat imaging is aimed to study the tumor microvascular heterogeneity in the future, and we think that's very promising in the future. And I would like to introduce our SRUS team, Dr. Dong, the moderator, and Dr. Jianqiao Zhou, who's here. And we have more doctors in different directions, like thyroid, like nerve, lymph node, breast, and we also have postgraduate majors in computer science, which will support our method. And we would like to welcome any researchers or doctors who are interested in SRUS imaging would like to join us, or we can cooperate with each other in the future. And I think, and we think that the future holds promise in SRUS in the future. And that's all my presentation. Thanks for your attention.
Thank you for Dr. Xia's great presentations. Ruijin Hospital had done so much work of SRUS in superficial organs, and we believe that with the continuous advancement of medical technologies, ultrasound image can not only be our tool in clinical diagnosis, but also for some research work. Ultrasound although traditional ultrasound is limited by the resolution, but now we had to find something new. I think this new technology can bring us to our new aspects of clinical application, and especially for hepatite analysis, I think it's a real promising area. And also, if we can combine AI, artificial intelligence, into our ultrasound work, I think we can find a breakthrough.